My name is Raul Borrego. I am a physician that practices in Farmington, in Parkland Health Center. I work for BJC Medical Group. My specialty is internal medicine, and what I'd like to talk to you about today is simple tricks in diabetes. And I refer to diabetes type 2. Type 1 is completely different. Type 2 is a condition that diabetes is the most important thing in correcting the high sugar. And to understand that, you need to first divide your meals into three big groups. Everything that you eat, that you put in a plate, is going to be one of three groups. It's going to be the carbohydrates, the proteins, and the fats. If I ask you to differentiate one from the other, sometimes patients cannot do that. But it's very simple. If you know what the fat is, it's the greasy thing that comes into a meals, the oil, the margarine. Then you're left with the proteins. The proteins is going to be meat. So whatever is left is going to be carbohydrates. That includes the cereal, the oatmeal, the fruit. Many patients like to come to the office and say, I have a good diet because I eat a lot of fruit and the sugar is very high. They don't understand why the sugar is high when they have a lot of fruit. But fruit is sugar and water. So what you need to do is, if what you need is the fiber and the taste and you don't want to eliminate completely, you have, for example, the option of buying vegetables and then a frozen fruit. Then you get frozen fruit and you mix it with the vegetables. And by doing that, you decrease the amount of carbohydrates, the amount of sugar in your diet, and you still have the taste and you have the fiber. So what is left then is that you have to divide the percentage of what you're eating in your plate. If you look at the plate, most of our diet is going to be very high in carbohydrates. And the high carbohydrates is they're going to reflect the elevation of the sugar. Only sugar raises the sugar. That's what you need to understand. Only sugar. If you get cereal, which you see in the television that is good for your heart, it might be good for your heart, but it's bad for your diabetes. If you get oatmeal, that's also carbohydrates. So then it's going to raise your sugar. So in order to have a better control of your diet, you need to differentiate what are these carbohydrates and try to eliminate as much as you can. The excess of carbohydrates also, when you have three sugars, for example, they are not being used, the body is going to pack them into triglycerides. Triglycerides are coming from three sugars. Most people think that it's coming from fatty or from cholesterol. So the triglycerides in the high sugar is the main problem with diabetes. If you address that, then it's going to be easier to manage your diet. Okay, thank you.